webinar today, we're going to walk through a Zane software demo. For the demo, we're going to be walking through a 6-person or 6-employee company, and it's going to assume that they've already set up the HRA and they've been using it for several years. And this will give us an opportunity to show you how this works from all vantage points. We're going to be walking through how it works for, number 1, an employer, number 2, a participant or employee, number 3, Zane Benefits as the claims processor, and number 4, you as an insurance agency or CPA, how you might be involved. So whether you're a participant, an employer, a Zane Benefits employee claims processor, or an insurance agent, this should be a helpful demo to explain sort of how you fit into the process. All right, so here's an outline of the company. So if you see on the screen here, we've got a 6-person company pulled up, and just so you know, that if you are an agent, you actually have your own sales site with your own set of demos. So if you have an affiliate account with us, make sure you set your sales site up. It'll probably be sales.zanehra.com / your username / demos. In this case, I'm using the example here. So the demo here we're going to be walking through is a company called Salt Lake Pizza Company, and what they did was they established ZaneHRA to reimburse employees for their individual health insurance expenses and out-of-pocket medical expenses. And they set this up a while ago. In this scenario, the information that we're going to be walking through is actually going to be based on real client data, but it's not going to be actual client data. So this is a demo, and it's fictitious people, fictitious company. That being said, this is a perfect example of the typical company that might set up a ZaneHRA for their benefits package. Salt Lake Pizza Company, prior to offering ZaneHRA, did not offer health benefits, and they could not meet the minimum contribution requirements. In other words, they couldn't afford a group health insurance plan. So they instead elected to set up the HRA, and they created 2 employee classifications. One called the manager class that they gave $300 per month towards, and one class called the waitstaff class that received $125 per month. So one of the benefits of setting up a ZaneHRA is that when the employer walks through the setup process, they get to define employee classifications, such as what the Salt Lake Pizza Company did in this case, managers and waitstaff, to give different benefits for different types of employees. So when they do this, they have to base the classes on bona fide job criteria. They can't say, hey, I like this person and I don't like this person. I'm going to give them different amounts. They have to be based on bona fide job criteria, so job role, job function, years with the company, waiting periods, that sort of thing. But in this case, it's a very simple plan design. They've basically giving the managers 300. There's 1 manager, and the wait staff people 125, and there are 5 managers. So this if I just to introduce you to how our demos work, this employer account link here, if I click that, it's going to log me into the employer account. And that typically is what someone in the office for Salt Lake Pizza Company is going to be using to manage the ZaneHRA account for the company. It's typically the person who manages payroll at the company, or the HR or office administration person. We'll walk through what that looks like in just a second. Once the employer sets up the account, they're going to decide how much money they want to give and what types of classes they want to create. And as I just mentioned, Salt Lake Pizza Company created a manager and waitstaff class. So when they create these classes, they then, after they create the classes, add employees to the plan. That all happens through this employer account. We'll walk through that in just a second. Once an employee is added to the plan, that employee is going to get a welcome packet via email that explains how to access the ZaneHRA benefits. And each employee is going to get a participant account. So these 2 links here, this participant account, waitstaff, and participant account manager, they are example participant accounts of what an employee at Salt Lake Pizza Company might see. So we're going to walk through actually what a manager would see and how they might request reimbursement through the system. Every Zane Benefits employer is going to be assigned a Zane Benefits claims processor. So when they submit claims or reimbursement requests to the system, it's going to be come into a queue that our Zane benefits claims processors review and adjudicate for reimbursement. Once a claims processor reviews a reimbursement request and approves it, we notify the employer that a reimbursement's due, and the employer typically reimburses the employee via the payroll system, the company's payroll system. There's multiple options, though, that the employer can cut a check or they can do direct deposit, but the most popular way of doing it is payroll reimbursement. So from start to finish, if you kind of think about how this works, the employer sets up the plan. They're going to create the employer account. They're then going to add participants. They're going to design the plan and add participants. That's going to create the participant accounts, and some of them may get different amounts based on the classes the employer created. The participants are going to go out and buy their own individual health insurance policy from any carrier, and they're going to submit a request for reimbursement through that participant account, and that could be for medical expenses or health insurance expenses. That's going to come to the claims processor at Zane Benefits, and we're going to review that information and approve it based on the IRS guidelines. Once it's approved, the employer is going to get a notification in this account that a reimbursement is due, and they're going to be able to record a reimbursement via their existing payroll system to tax-free. All of this is managed 100% online. The employers and employees can access this 24/7, and so there's no paperwork involved in the setup or administration of this, which means an employer can set one of these up in about 10 to 15 minutes online and then administer it in less than 5 minutes per month, which makes this a really sweet solution for a small business, especially when they want to be focusing on their core business, not their health insurance. So what the one account here that you may be looking at and wondering what is it is this insurance agency account. The insurance agency account is basically the Zane affiliate account, and what that does is it lets an insurance agent or carrier or provider plug in insurance services into the account. So if you're an insurance agent, you have an account like this, and based on what insurance agent the employer sets up with, they're going to enter a code when they sign up to track a referral. That's what health insurance services are inserted into the system. So when the employee gets their welcome packet, it directs them to the affiliate that is designated to their account, or the insurance agency that's designated to their account. So, for example, let's say you have an agency and you refer a client to Zane Benefits. That client's going to sign up under your referral code, and they're going to see your insurance services in the system. So they call you for health insurance. So very, very cool here, which means the employer gets to stay out of the health benefits or health insurance decisions. The employees are going to contact the health insurance agency for quotes. So very, very slick system here. When participants it's going to get transferred into this insurance agency account, so that if you staff a call center or you have employees that are managing these accounts, you can make an outbound call to the employee and actually help them pick the right policy for them. Today we're going to be focused on the employer account and the participant account. We're not going to spend a lot of time in the insurance agency account. So if you want more on that, we'll probably do a webinar next week or the week after focused on how to use the insurance agency account. So if you're interested in that, that's not what we're going to be walking through today. So as far as what we're going to be walking through today, first we're going to log in as an employer account and show you how this thing looks from an employer's perspective. We're then going to take the reins of an employee account and actually experience what an employee would experience when they request reimbursement. And we'll follow that reimbursement request all the way through the claims processing account at Zane Benefits to the payroll reimbursement by the employer. And if you, just so you know, if you want to access these demos, if you type in this URL right after the webinar today, you'll be able to actually click around in these demos too if you want to and try to break it. You can click any button you want to. You can't break it. But it's fun. There's a lot of features in here that we're not going to cover. We're just going to cover the big ones. All right, so let's go ahead and log into the employer account. So again, this is the administrative account that the employer establishes when they create a Zane Benefits or ZaneHRA plan. And this is the ZaneHRA dashboard for the employer. It's a very, very easy to read dashboard. This is what the employer can log into, or typically the payroll administrator at the office can log into and say, okay, here's the summary of my plan. I've got 6 active participants, 5 wait staff, right here receiving $125 per month, 1 manager receiving $300. It looks like Jose here is the manager, and these other 5 employees are the wait staff. I've got total outstanding balances of $2,700 or $2,729. That's the sum of all the employees' individual balances. So each time they receive an HRA allowance and they don't use all of it, it accumulates from month to month. And then it looks like there's some unpaid claims. And what these unpaid claims represent is these reimbursements due. So they have $474 in reimbursements due for each of these employees. And this is pretty typical. Most employers are going to record the reimbursements once or twice per month on a paycheck, on a payroll. So this will be a great opportunity for us to show you how it works for an employer when they record the reimbursements. So let's see here. If you look here at Jose Leo as an example, he's getting a $300 allowance. He's got a balance of $1,102.50. It looks like he submitted a claim for $39.60 that has not yet been reimbursed. Since his balance covers the reimbursement request, it's showing a reimbursement due. If this unpaid claim amount was greater than the HRA balance, the reimbursement due would be capped at the HRA balance. And that's a huge advantage of an HRA from an employer standpoint, because their liability is capped at what they've contributed or made available through the HRA to date. So if the employee leaves, that liability doesn't continue to increase. The other key feature here is that these unpaid claims, let's say Jose here submits a claim for $10,000. It would come in here as unpaid claims of $10,000, but the HRA balance is still only $1,100, so the reimbursement due would be capped at this. A big feature for the employee and the employer is that we'll actually track the unpaid claims. So he's not going to lose that unpaid claims. As long as he stays with the company, he'll start paying down that claim as he receives new allowances. And that's called our unpaid claim tracking feature. All right, anyway, this is a great example of how this might look for a company. If I'm the payroll person or I'm the person administering this for the company, I'm going to log in here for one of 3 reasons once I set it up. I'm either going to record reimbursements. I've got 6 reimbursements due right now. I'm going to add a new participant. Look at that quick link. Or I'm going to terminate a participant from the plan because they've left me. That's really the main reasons they're logging in. Now, there are some reasons that log in for reporting and plan changes, but those are usually on an annual basis, not on a daily or weekly or monthly basis. So let's just assume that it's payroll is due today, and the employer needs to record the reimbursements. That payroll person is going to log in here. They're going to see these reimbursements. They have a choice. They can record each reimbursement individually by writing a check, adding it to payroll, doing online banking. Or what most companies do is they like to do it all at once. So they'll click this Reimburse Batch Payroll, quick link here. It'll sum up all of these different reimbursements due. They'll put the payroll system, let's just say the payroll is for Friday. So we'll put 7/20/2012. They can actually insert their payroll system link in here for compatibility, and then create and record the reimbursement batch. As soon as they recorded that batch, it updated all the employee ledgers and emailed each employee letting them know that their reimbursement and these amounts here is going to be added to their paycheck. So that employee just got an email saying, hey, look for this reimbursement on your paycheck. Now the employer sends this file, this Excel file, to their payroll specialist or their payroll provider to actually add it to the reimbursements. If they do it online, they'll just copy and paste these amounts into the system, such as QuickBooks. Or if they're with Paychex, for example, they'll send this file over to their Paychex payroll specialist, and Paychex will handle it for them. So great, very, very easy. And then the reimbursements have been recorded. So now if I go back to the home screen, look at that. There are 0 reimbursements due now. The total balances have been deducted by the reimbursements we just recorded, and we have no more unpaid claims. So what we just walked through right there was an example of how the employer would use this on a monthly basis to record reimbursements. Extremely easy. If I'm not adding a participant or terminating a participant, I'm done for the month because typically I'm only going to reimburse once a month. I'm going to let the reimbursements accumulate until one payroll schedule. So this employer's done. All right, so that was the reimbursement process. Let's talk about how we added participants to the plan. The employer can log in here at any time and add a participant. So let's just say they hired someone and they want to add a participant. They'll click here to add the new participant. And this is the information we require. We require first name, middle name, last name. They'll put in their family status, the date of birth. If they have an employee ID that they track with, they'll type that in as well. They'll put a daytime phone, maybe an evening phone if they have one, and then an email address. The email address is really important because it allows us to communicate with the participant without them having to log into the system and without the employer having to contact the participant over and over again, or via fax or in person. If they don't have an email address, we let them check a box saying, hey, there's no email address for this participant. But 99% of the participants in our system actually have an email address, so that's really not a problem. The mailing address is required as well, the state and zip, and then they'll start adding dependents, so they can add a child or a spouse. And let's just, we're not going to actually add anyone here. I'm just going to show you how it works. And then they're going to pick what class that participant goes in. If they're a manager, they're going to go in the manager class. If they're a wait staff, they'll go in the wait staff class. Then they'll pick the effective date. It could either be the first, it could be in July, maybe it's in August. But they'll pick the start date when that employee is going to become effective. We'll say that this person is going to start on the 1st in 2012. Once they add the participant, or once they select all this, they can decide to put an optional initial balance. In other words, they can fund, you start the HRA balance at an amount greater than 0. So if they put $1,000 in here, the employee would start out with a $1,000 HRA balance. Now, most employers leave this at 0, but it's an option that we give just for flexibility. I'm actually going to go ahead and fill all this out as an example, and we'll just fill in some fake information here. Steve Smith, we'll say he's single. Let's just say his date of birth was the 1st of January in 1980. His employee ID we'll say is 383438. His daytime phone we'll put 555-555-555. We'll put his email address as steve.smith@zanebenefits.com, and we'll have to put it in twice because we want to make sure it's confirmed. We require them to validate the email address. 123 fake street in fake city, fake state. And we'll put it, if he has dependents, we put him here, but since there are no dependents, he is single, we're not going to add him. And we'll say that he is a wait staff person, and he's going to be effective on the August 1st. We're going to click the Submit New Participant, and automatically he's added to the plan. All the employer has to do to notify the Steve of the plan is to click this button to email Steve the welcome letter. As soon as they do that, the system automatically emails the welcome letter, and then the employer can print or view the welcome letter and hand it to him in person as well. But we actually handle all of the compliance requirements via that electronic notification automatically, provided that they have an email address. And so very, very slick system. The employer's done. You can kind of see here that we create the username and password for the participant. Real nice. Now, if you're an insurance agent, make sure that you have your quote engine established so that it fills out to get your free health insurance quote. So it will plug your health insurance information in here if you have your account set up correctly, so that the participant will call you. If the employer has more participants to enroll, they'll click on Enroll Another Participant. Or if they want to reimburse or add a bunch of participants or a batch of participants all at once, they can do so by adding a participant and downloading the batch enrollment file. So very, very slick system, easy for the employer to use. But I think we've covered most of what we want to accomplish. You can see here that Steve Smith is now in the wait staff class. He has a balance of $0. And he'll receive his first allowance on the August 1st. Let's dive into a little bit more detail on Jose's ledger, and this is actually really important. When companies ask us why we exist, there's 3 reasons. 1, tax savings. That's the whole point of an HRA, is to get tax savings on medical expenses and health insurance expenses. Number 2, compliance. The employer, when they're reimbursing medical expenses, can't know what employees are spending the money on. So when the employer is in the account and they look at these ledgers and where all the money went, they can see the monthly allowance going in on the first of the month. They can see that claims are being approved, but they cannot see what they're being approved for. And that's a very, very key feature here. They can see the amounts, but they can't see what type of expense or who the provider of service is. And then we keep track of a full ledger from the very beginning of time and for each year so that the employer can have this for IRS auditing purposes. So if there was an audit, we have all the information that's ever been processed through the system in digital format. So in the case of IRS audit, they can show where all the money went. Pretty slick system. The other piece is when the company sets up, they have to have plan documents. We electronically create the plan documents based on the class options. So you can see here that each class has its own set of plan documents. And the employer can actually edit these via the class options page. So if they come into my account, they can actually edit their plan in real time. So if we look here, we've got the wait staff. It looks like this plan started initially in 2011, and it renews in January. So we're in the current plan year of January 1st through December 31st, 2012. If they want to edit this or add a new class called drivers, they can do so. And they can give a different allowance if they want to. There are a plethora of features that the employer can set when they add a class. Just to give you an idea of what some of those are, when they add the class, they can set minimum hours worked weekly. They can set a waiting period for new hires up to 20 years. They can give allowances annually instead of monthly. Maybe if they want to give different amounts for family status, maybe they want to give married without children 250, single participants with children, and family 300. They can give different family status a different amount. Another key question that comes up when an employer establishes an HRA is what happens to the money at the end of the year? Does it stay with the company or does it roll over and accumulate from year to year? That's called our rollover, and by default it all rolls over, but the employer can cap by family status what gets rolled over each year. Additionally, they can disable the unpaid claims rollover, which is a great feature, but most employers leave the default enabled here. If you want to go into a lot of detail, really the employer can do whatever they want to when they set up the HRA. They basically design this thing from scratch. But they can we have 15 different categories of expenses here, maybe it's 14, that they can choose, hey, I don't want to reimburse health insurance premium. I do want to reimburse dental expenses, but I want to limit the amount to $300 per year. I like chiropractic, but I only want to reimburse 50%. And I just don't want to reimburse over-the-counter expenses. So when they create this, they can actually design what types of expenses are reimbursable for the employee. And so very, very flexible system. I'm not going to complete this class, but it should give you a good idea of what the software can do. Most companies don't use many of the features. They keep it real simple and say, hey, here's $300 a month. Use it on whatever you want to. But we have flexibility to do whatever they would like to do. Additional features, they have utilization reports so they can see how much money is being used on a class-by-class basis. They can also see claims report by nature of expense. They can see where their money's going. Is it going to dental, chiropractic, pharmacy? When they're reimbursing health insurance premium, they typically spend most of their money on health insurance premium versus the other types of expenses. All right, so I think that's we've covered the employer account pretty well, and I know we're coming up on time. If you'd like to jump off, feel free to. I'm going to keep going and get through the participant account. But you've got a really good understanding of what the employer account's like now. So now, what happens when a participant wants to request reimbursement? Let's just take the manager here. I believe his name was Jose. Let's log in as Jose. So yeah, we're in the account dashboard for Jose here, and we can see his current account summary. He has a monthly allowance of $300. His HRA balance is $1,662. And he has no pending claims. You can see here, he can see his recently approved claims. He can see any rejected claims he has. He can see what expenses are eligible for reimbursement. There's an FAQ system. If you sell health insurance, if you're an insurance agent on this line, make sure that you customize the HTML ad that's showing up here. You can customize this ad in this ad to show your health insurance service. So if you get a quote advertisement or link to a quote engine, make sure you insert it in there. If the employee needs help from a Zane Benefits representative, they can email help@zanebenefits.com or visit help.zanebenefits.com or call our 800 number for participant support. We have an online support system where they can submit a support ticket, and we'll give them a call back as soon as possible. Or, of course, they could call the 800 number. Really, the only reason the employee logs in here is for one reason, and that is to request reimbursement. So let's just say Jose here needs to submit a request for reimbursement for his health insurance premium. He's going to come in here, click health insurance premium. Let's just say he's with Cigna. We'll put the person receiving service as Jose, and he's submitting for his July premium. So we'll put the period of coverage for July. We'll just say his amount's $200 per month. And he's going to attach, he has 3 options of documentation here. So in order to get reimbursed, the employee has to provide proof that they actually had this expense. It's actually not proof of expense. We call it documentation. In order to get reimbursed, Jose has to show, number one, how much this amount was due, this period of coverage, 2, the date of service or period of coverage has to be shown in the documentation. The person receiving service, whether it's Jose or the primary person on the policy, has to be listed there. And then the provider of service, which in this case is Cigna, has to be provided on the documentation as well. So usually he will get this from the carrier in the form of some sort of receipt or policy confirmation document, and we'll attach it digitally here. If he wants to fax it, he will click I will fax it later, or if he wants to mail it in, he can do that. The quickest response times, they're going to attach documentation here, and they can attach as many as 3 different pieces of documentation to get it approved. Most only need to provide 1 piece of documentation. And if they don't want to attach documentation, he wants to fax it, we'll do this for the demo. He will fax it in, and we'll provide him a form afterwards. If he has comments such as, hey, please approve this fast, or call me with any questions, he can put some notes in there for the claims processor. Once he's got his documentation selection complete, he's going to click Submit Claim. As soon as he does that, he's going to get an email letting him know that we've received it. Now, since he submitted documentation via fax, he's got to print this cover sheet and actually attach the documentation and fax the documentation over. And then our claims processors will attach a digital copy to the receipt. So let's just see. It automatically should update his. Yep, look at this. It's automatically entered in all of the facts. We've got a claim number here of 23163 to track the claim. And all Jose has to do is find a fax machine, attach the receipt, and send to this 800 fax number here. And then he's done. Now, if he had just attached the receipt digitally, he'd be done already. This is just an extra step for people who don't have access to a scanner or electronic billing. So if I go back to the home screen, we can see that he's got this pending claim for health insurance premium. He's done. He's waiting for Zane Benefits to approve that claim or the claims processor to approve that claim. Once the claims processor would review that and approve it, it will show up as a reimbursement due in this employer account. So hopefully that gives you a good idea of how this thing works. The idea is real simple. The employer sets up the plan, adds employees. Employees incur medical expenses and health insurance expenses. They request reimbursement. Zane Benefits approves the reimbursement request, and the employer adds them to payroll. All of this should take the employer less than 5 minutes per month to administer and result in a really happy client. If you're an insurance agent, it's a great opportunity for you to plug in your health insurance services and offer your individual services as part of the HRA platform.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now, everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is, and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law. Opening October 1st. You can learn more right here, right now. And be ready for the new world of health insurance shopping.